Hi there and welcome to this session. My name's Professor Deborah Davis and I'm Professor of Midwifery at the University of Canberra here in Australia. This session is going to take about half an hour and it is supported by some worksheets that you'll be able to apply what you know and practice doing some calculations for yourself. Today we're going to look at odds ratios and relative risks. And there's some calculations that are really useful when you're trying to understand what the outcomes are for one group compared to another group. And if you can get a handle on these, they'll really take you a long way in understanding how some research is presented. But let's start with the clinical question, because I always find that that's an easy way into presenting some of this research stuff that looks a bit incomprehensible when you start out. So, as a midwife, if a woman came to you and asked you, if I use the bath in labour, will that mean that I'm less likely to have an epidural? You might know the answer to that, but if we said to you that the answer is also here in this little summary of letters and numbers, I wonder if you know what that means. If you do, this session will be no more than revision for you, but if you don't know what that means, then stick around because it'll be clear to you by the end of the session. We're going to be focusing in this session on this little part of the equation, and we have other recordings that will deal to this part, the 95% confidence interval. This part's really important, but let's get to grips with this part first. This is a forest plot, and it's the way that research findings are often presented as well, particularly in the Cochrane Review, where a number of different studies are contributing a pool of data to a new analysis. We'll have another session that will focus on this as well, but this is just to show you how odds ratios are sometimes used in the Cochrane Review and meta-analyses. So what we'll do today is we'll look at two different types of data, continuous and categorical. We'll have a look at what is meant by exposures and outcomes in the context of research, and we'll look at interpreting and calculating odds ratios and relative risks. We won't focus on the forest plots this afternoon, but as I said, there'll be another session that will have a closer look at those. So first of all, types of data. One type of data is called continuous data. That's numeric, and it's data that presents on a continuum, something like, for example, age, height, weight. They're examples of continuous data. And when a researcher or someone reading research might be looking at differences between one group and another, the information that's provided to you is often a mean or an average. So what is the mean of that outcome for one group compared to another group? You might also see median and standard deviation presented. So here's an example of some continuous data that's presented in a table. Many research reports have tables like this. It's the characteristics of women by planned place of birth. And if we have a look at the categories along the top, we have women who are planning their place at home, we have primary unit, a secondary and tertiary hospital. And in the characteristics over on the left hand side, the first line down, we have mean age. So this is presenting the mean age of women in these different groups. So you can see that the mean age of women planning a home birth in this study was 30.4, which is a little bit older than the women planning to have their babies in other sorts of settings. And in the brackets here is standard deviation. The standard deviation represents the degree to which the results are dispersed around the mean. So a high standard deviation would tell you that the results is quite a wide range. The ages might go from 15 to 40, for example, and be very spread out. You'd have a high standard deviation. If you've got a low standard deviation, it means that the results are more clustered around the mean. So that's continuous data. Another type of data is categorical, and this is when information is sorted into some sort of category, and the name of the category isn't so important. It could be the the blue group, the black group. It's as I said, it's not that important. Some examples might be education status, and the categories within that might be has completed primary level school, has completed high school, has completed tertiary education. Parity is another example. And within that, there are binary categories. So that's when there's only two options, a yes, no, or a male or female. So obviously with that sort of data, there is no mean to present, but one of the calculations that can be done to compare groups is risk and odds, and that's what we'll look at today. So here's an example, but back to that same table, and if we come down to ethnicity, that's categorical data. So in this study, the categories are New Zealand European, Māori, Pacific Islander, Asian, or other. And what is presented in each group is the number of women who fall into that category and also the proportion, so a percentage in the brackets. Okay, so now let's focus on exposures and outcomes. So often in research, the researchers want to understand what the outcomes are for at least two different groups. One group potentially who have had some sort of exposure or treatment, and another group who haven't. So an exposure might be something like a new treatment or medication. It could be a training regime, a particular diet or lifestyle, or even exposure to things like pesticides, or even experiences like the experience of war. Then the outcomes that they're interested in, and often there are many, but there's one primary outcome, could be something like cure from disease, fitness level, events such as heart attack, and in the maternity setting it might be events like a caesarean section or a normal birth. So let's have a look in these different examples and see if you can identify the exposures in these cases. So the first study is a cohort. It just means looking at a group, looking at the rate of breast cancer in women taking oral contraceptives and those who aren't. The next one is another study looking at rates of normal birth for low-risk women who are having their babies in hospital or at home. The third one is a randomized controlled trial looking at the effect of a drug, streptokinase, on survival rates for people who've had a cardiac infarction. And the last one, again, an RCT looking at the effectiveness of an individual counselling program on some sort of measure of physical activity, fitness and health. So just take a moment and think about what's the exposure in each of those examples. And here they are for you in red. The first one, it's the contraceptives, taking the contraceptives, that's the exposure. In the second one, it's the birth setting, whether it's in a hospital or at home. The third one is a drug, streptokinase. And the last one, it's having the individual counselling. That's the exposure. So now take a moment to think about what are the outcomes in each of those studies. So there they are again in red. In the first one, it's the rate of breast cancer is the outcome that the researchers are interested in. In the second one, it's normal birth. The third one, survival rates. And the fourth one, it's some sort of measure of physical activity, fitness and health. So now let's focus in on this calculation, starting with the odds ratio. So it's really the odds of an outcome occurring in one group compared to another group. So we'll use an example. So let's say, for example, that a study had 20 participants, 10 in each group. Now I know that you're not necessarily going to change your practice based on a study with only 10 people, but let's just go through the motions with this. So this study is going to examine the effects of a new lotion called Nipple Guard on nipple damage with breastfeeding. So you can see that the exposure is the lotion, and the outcome that we're interested in is nipple damage. So let's say that 2 out of 10 participants who used the nipple guard got nipple damage, and 1 out of 10 who didn't use nipple guard got nipple damage. It's probably easier if we do this graphically. There we are. So you can see, and you can start to intuit what the odds might be of getting the outcome in these different groups. So if you didn't use lotion, only 1 person out of that group got nipple damage. If you did use the lotion, 2 people got it. So based on that, if say this had a sample size of 100 times this, you could see that you're probably more likely to get the nipple damage if you use the lotion. So it's probably not something you'd recommend to the women in your care based on this study. But if we're thinking about odds, the odds of getting the nipple damage looks like they might be higher in the nipple guard lotion group compared to the other group. One of the ways that we can input data to make it easier to make these sort of calculations is called a 2x2 table. So when you've got 2 groups and you're interested in one particular outcome, you can factor in the different details of the findings of the study into a table like this. So let's put in the data for the study on our nipple guard. There we are. You can see in this left-hand column we have exposure, so we have people who did use the nipple guard and people who didn't use the nipple guard, and then we need to put in the numbers according to the outcome. So how many women in the nipple guard group got nipple damage, and we know that was 2. We know there were 10 in total in that group, so we can work out that 8 didn't have nipple damage. And then we can put in the data for the number of women who got nipple damage who didn't use the lotion. No lotion. 1. We know there were 10 in the group, so that meant that 9 didn't have nipple damage. So you'll be familiar with the meaning of odds, particularly if you sometimes have a bet on the horses. It's all about odds. It's the probability of an event occurring or not occurring. So, for example, what are the odds of you throwing 2 6s on a set of dice? I don't know what it is exactly, but we could work it out. And they can also be expressed as ratios. So in a group of 9 people, if 6 get a disease and 3 don't, the odds are 6 to 3, and that can be reduced down to 2 to 1, or even down to one number if you divide 2 by 1, which is 2. So that is, a person in that group has twice the odds of getting the disease as not getting the disease. So what do you think would be the odds of nipple damage for those who used the nipple guard compared to those who didn't? When we looked at it graphically, we could see that you probably had more risk if you used the lotion, but we can work out the numbers. So there's a formula, and these letters relate to the cells in the 2x2 table. So the formula for an odds ratio is A divided by B, and that number is divided by C divided by D. So we'll look at that with our table. These are the cells A, B, C and D. So our formula is A divided by B, which is 2 divided by 8. That's here. And that number is divided by C divided by D, which is 1 divided by 9. If you do that calculation, you come out with a number of 2.25. So the odds ratio is 2.25. What does that mean? It means that the odds of nipple damage in the nipple guard group is 2.25, 2.25 times that of those in the no lotion group. More than twice. So they have more than twice the chance of getting nipple damage if they use the nipple guard lotion. Okay, let's try another example with different numbers this time. What if 5 out of our 10 in the nipple guard group got nipple damage and 5 out of 10 in the no lotion group got nipple damage? We'll look at it graphically first of all. So based on that, would you recommend the lotion to women in your care? Probably not. Same, isn't it? Same chance of getting nipple damage whether or not you use the lotion. But let's go through the motions and work out the numbers. So A divided by B, remember, is we've got 5 in this case, so it's 5 divided by 5, and that number is divided by 5 divided by 5. And that is 1 divided by 1, and that works out to be 1. So that's a really important number when it comes to odds ratios, and it is as well when you calculate relative risks, because an odds ratio of 1 means there's no difference, no effect. The treatment has no effect on the outcome. We had an example just now of an odds ratio that was greater than 1. Ours was 2.25. So that means that there is more of the outcome in the exposed group. You can also have an odds ratio of less than 1. It might be 0.8, for example, and that means that there is less of the outcome in the exposed group. So in our example, if we had an odds ratio of 0.8, it would mean that the women exposed to the nipple lotion had less chance of getting nipple damage. Now this is a little bit blurry, but this is the way that some results can be presented in an abstract, for example, where the results are written out. And in this case, it's a study that was comparing women's chances of preeclampsia according to their BMI category. So there's always a reference group or something that it's being compared to, and in this case the results are being compared to women who have a normal BMI. So in this first 2 lines we can see that morbidly obese women had the highest risk of preeclampsia, and we can see here odds ratio 7.2. So what that is saying is that women who were morbidly obese had more than 7 times the chance of getting preeclampsia compared to women of a normal BMI category. If we continue, as I said, we'll focus on this sort of really important bit in the brackets in another session, but we're just getting our head around this bit first of all, the odds ratio. Just keeping along that sentence, the underweight women had the lowest chance of preeclampsia. So their odds ratio, we can see it here, is 0.6. So remember, if it's less than 1, they have less chance of the outcome. So they have less chance of preeclampsia compared to women of a normal BMI. When the odds ratio is less than 1, to work out how much less chance they have, you need to take this number away from 1. So if we said 1 minus 0.6, we're left with 0.4, which is about 40%. So you could say they have about 40% less chance of preeclampsia compared to women of a normal BMI category. So these results again presented in a table this time, which you often see. So we have crude and adjusted risks of obstetric complications. Again, we're just looking here at the preeclampsia for women in the different BMI groups. We'll adjusted risks, which we'll have a look at in a little while, is a more finely tuned analysis, and it takes into consideration some of the other factors that might influence on a woman's risk of preeclampsia, like for example primiparity or a new partner. So you should always look at the adjusted odds ratio or adjusted relative risks, but they're too complicated to work out by hand, so we're just working with the crude ones in these examples, but you read them in exactly the same sort of way. So we've got an odds ratio. As I said, we're working with the crude ones, and we look at the underweight group, we can see that they have less chance of preeclampsia compared to women of a normal BMI. How much less? We have to go 1 minus 0.7. So they've got about 30% less risk of getting preeclampsia if they're underweight compared to normal weight. The overweight group, we can see the odds ratio has moved to over 1, so they've got more chance of the outcome, 1.7. So they've got 1.7 times the outcome of preeclampsia compared to women of normal weight. When we get into obese, that number's climbing up. The odds ratio is 3.3, so they've got 3.3 times the chance of getting preeclampsia, which is more than 3 times the chance. And the morbidly obese women with an odds ratio of 7.4 have more than 7 times the chance of getting preeclampsia compared to normal weight women. So, just looking now at the first part of that equation that we started with, we've got an odds ratio of 0.82. So what this is telling us is that women who use the bath pool have less risk of the outcome, which is epidural. So there's less chance that a woman using the pool will use an epidural for labour. How much less risk? Remember, we have to take this away from 1, so 1 minus 0.82 is about 0.18 or 18%. So about 18% less chance of them using an epidural if they use a bath pool. Okay, we'll quickly cover relative risk now because a lot of the principles are exactly the same. Relative risk is a way of comparing the likelihood of an event occurring in one group compared to another. It's about what is not about what are the odds of it happening, but what is the risk of it happening. Relative risks can't be used with all study types, and in those situations people will use odds ratio. But you read and understand them in the same sort of way. So the formula is different, as you can see. A divided by A plus B now, instead of just B. And that's divided by C plus D. So the formula is different, but you read them in exactly the same sort of way. So we'll just work through another example here. In this study, we've got women who limited their weight gain in the antenatal period, and the outcome that we're interested in is whether or not they got gestational diabetes. So that's a binary outcome. It's a yes or a no. We can see we've plugged in the numbers into the various cells. So this is telling us that in the women who did limit their weight gain, we had 9 women who developed gestational diabetes out of a group of 84. And in the women who didn't limit their weight gain, we had 22 women who developed gestational diabetes out of a group of 85. Now this is a fictitious study, I have to tell you. These results are completely made up. So we use the formula that was presented a moment ago, and it is 9 divided by 84, and that's divided by 22 divided by 85. That gives you this line here, 0.11. EER just stands for the experimental event rate, and CER is the control event rate. But that calculation comes out at 0.42. So to explain that finding in words, it is those who limited weight gain in the antenatal period were 0.42 times as likely. Remember, it's less than 1, so we have to do 1 minus 0.42. I've said about 60%, but it's exactly 58%. Less likely to develop gestational diabetes than those who did not limit their weight gain. So this last bit's always important. Who is the comparison group compared to those who didn't limit their weight gain in the study? You read it the same way as you do for an odds ratio. So if you have a relative risk of 1, it means there's no association between the exposure and the outcome. There's no difference in the two groups. A relative risk of less than 1, as we just saw, meant there is less risk of the outcome in the exposed group, and a relative risk of greater than 1 means there's more risk of the outcome. So here's a little bit of a busy table, but let's focus down on just one of the outcomes. Let's look at the crude RR, which is relative risk. And this study and these results are looking at the risk of intrapartum death for women in a couple of categories. So ones who intend to give birth at hospital at the outset of labour, those who intend to give birth at home at the outset of labour, and those who are unknown. So we follow this along. These are just giving us the raw numbers of women in each group. This is giving us the percentage, or the number and percentage who had the outcome. Luckily it's a very rare outcome. Now this number 1, if we look at the hospital group, the 1, or sometimes they will say reference group in brackets, that's the group we're comparing to. So if we look at the home group, we have a relative risk of 0.83. So it's less than 1, so it means that the home birth group are less likely to have the outcome of intrapartum death compared to the hospital group. How much less likely? We have to say 1 minus 0.83, which is 17%. 17% less likely to have an intrapartum death if they're planning a home birth compared to planning a hospital birth. Now the part of the equation we haven't dealt with is this part in the brackets here, which is the confidence interval, and it makes all the difference. So just hold that result a little bit tentatively for now until you move on and discover what this part in the bracket means, because it's important. So that's all we have for this session, and I hope you enjoyed it. Please move on and use some of the worksheets and practice that, and come back to us